So we think that Lane and Sherry were probably both stuck in the same traffic jam. It's our guess. So I get to start the meeting. For anybody that doesn't know me, I'm Harriet Hall. And I'm calling the meeting to order. And our first item is to accept the consent agenda. And first, though, I should
Actually-
ask whether there's changes to the agenda.
Actually, I was just gonna say I can do roll call first and then,
Let's
yeah,
do roll call.
okay.
Right.
We should.
There's a novice who's doing it to help out.
No
Okay.
problem. Okay, so Sarah Lampy, Rochelle Woods,
Present.
Harriet Hall,
Present.
and for the record, Sherry John and Lane Drager are absent and a quorum has been established.
Okay, so now our first item of business is the consent agenda, which includes the acceptance of the agenda. Does anybody have changes for the agenda? All right, then I would entertain a motion for acceptance of the consent agenda, which includes both the agenda, the minutes, and the approval of contracts, all of which we've seen in advance. So.
I would second that.
I'll move.
Okay,
Michelle, you want a second?
Oh, yeah. Can you hear me?
yes,
Okay, I'm sorry. I don't think I spoke loud enough. I'm gonna adjust my microphone. My bad. Sorry. Okay. And yes, I second that. Thank you.
all in favor?
Aye.
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 All right, moving on to the public comment period, but I don't believe that we have anyone
Right.
signed up for public comment. So we will move on to the financial report. And Joe, I believe you are here as well as online. Okay,
Yes, I am here. Thank you. So I am filling in for Salma. She is en route to someplace far away for vacation. So she's not here today. So bear with me as I kind of get reacclimated to this presentation and financial figure. As you'll notice, first and foremost, I'm sorry to do this to you, but I'm going to refer back to the spreadsheet instead of using the PowerPoint slides. Selma did go through the trouble, and I'll apologize to her when she returns. Going through the trouble of putting together a presentation. I personally would rather do it this way, if you don't mind. Only because I'm going to bounce around a little bit. I thought it would be a little easier to navigate around these numbers if I had to follow this budget. So looking at grant funding, we are at 91%, and I'll try to highlight this. First and foremost,
And
if I need to,
sorry, can you just speak up a little bit louder? I just,
no idea where the microphone. Yes,
yes, thank you.
do that. So, please let me know if I need to, make these figures large or if I'm finding where they are. I'll just keep moving along. Sorry. So, first and foremost, grant funding, we are at 91% of the annual budget. You know, we are only roughly about 33% through the year. That is primarily because of additional grant funding that we've received. Primarily the ARPA 6.1 revenue replacement funds were not part of our budget. So that really attributes to that additional funding. There's been a lot of ebbs and flows with grant funding, as is typically the case. But again, the significant portion of that is attributed to that ARPA funding that we have available to us in this fiscal year, but not part of our original budget submission. So we do anticipate being significantly over budget at the end of the year. We are still working on those projections, but at this point, we are almost about $800,000 over budget. The prorated budget for grant funding at this point would be roughly about $8 million. We have reported $8.8 million. So we can look at this, we're already roughly about $800,000 over budget. Again, that's attributed to that ARPA funding. Charges for services, I know someone's gone through this to a lot of degree as to those additional revenue figures that have been recorded that really weren't part of that budget submission. When building charges for services, we really kind of took a conservative approach, really taking a turn from where the last few years had been with where we were seeing some of those services and the revenue attributed to those services and really try to get back on track. We tried to take a more conservative approach. So this is not too out of what was expected, but we are projecting to be over budget at the end of the year. At this point, we're already about 13% over budget. But again, this isn't too surprising. We just didn't want to project out too far ahead and get into a reverse situation where we were too far under budget. So taking a conservative approach seems to be the best we could do for building this year's budget. Yeah,
Clarification. When you say over budget, you mean brought in more revenue than we expected?
Yeah.
Okay, good.
I said,
Yes.
Yes.
It just sounds so bad when you say over budget. I don't want it to be taken out of context. We mean we. have
I
brought in more
will
than
try
expected.
to, yes.
Yeah.
We brought in more revenue than we anticipated
That sounds
through
much
this
better.
point of the fiscal year. We expect to surpass the annual budget for revenue projections at the close of the fiscal year.
Beautifully said.
Thank you.
Yeah, yeah.
It's very hard because it depends on how you look at the negatives and the positives from an accounting perspective, from a debit. Long story short, we're doing good. Thank you. Salaries and benefits, now jumping down to the expenditures. I apologize. I'm gonna try to keep this section on the screen for now. We kind of do a side by side or a comparison as we go through the expenditure categories. The majority of our expenditures is related to salary and benefits. At this point, we are below budget. We are under budgets, recording 79% of the annual budget after being 83% through the fiscal year. Although this may seem as though we have a budget savings on the salary and benefits line, it is due to the way payroll is posted throughout the fiscal year. We have 2 months in particular, we have 3 pay periods. So we've not had that second 3 pay period month. So what I can say is, even though it looks as though we're under budget for salaries and benefits, we are right on target with our salary and benefits. The other figures in expenditures, supplies, services, direct assistance, you'll see that we're surpassing the annual budget. Realistically, some of that is associated with the revenue contracts, the grant funding, the charges for services. There's a correlation between the additional revenue that we're bringing in and those additional costs that are associated with that revenue. In particular, we have intergovernmental expenditures, where we had a projection of $329,000 for the fiscal year. We're at almost $300,000. So 91% of the annual budget has already been recorded. That is associated with fees paid to the state for vital records as well as permits. So as you can see, we're charges for services, we're over budget. For those particular services, we're also seeing the correlation between those costs as well. So even though we're already at 91% of the budget, we have the revenue to offset overage as well. Wrapping up some of these figures, we are at 83%, so we're right on target with expenditures through this point of the fiscal year. And looking at the county transfers to public health. We have a budget of $9.3 million. At this point, we've only realized $6.7 million of county funds, which relates to 71% of the annual budget. The reason for the ratio being so low, even though again we're at 83% of the year, is because of the additional revenue. If you look at the way we are utilizing county funds, looking at our expenditures, and this is one of the reasons why I want to have this spreadsheet up here. We are utilizing roughly about $1 million of county funds a month at this point of the fiscal year. So seeing as how these are this is the reporting through October, we have November and December. If we're looking at $2 million per calendar month, we should burn roughly about $2 million and have $700,000 remaining of the county funds. However, there's the additional pay period. which will account for roughly about $500,000. These are very crude numbers, but I want to give the board some assurance that we do anticipate utilizing all of the county funds that have been allocated to public health for this particular fiscal year. We are also anticipating some flexibility or budget savings that we utilize for projects that we have not discussed at this point and that we are considering moving forward. With that, are there any questions that I can help with?
So with the additional revenues, congratulations, doing well. But not seeing a match in additional expenditures, is that anticipated to then additional revenues to be expended in the next or in the next calendar year, or how are you, like, where is, you know what I'm saying? Like the map, like I would anticipate if we're at 92% of budgeted revenues, we'd be closer to 92% on expenditures, that they would match a little closer. I know the additional salaries and benefits will make up a portion of it, but I wouldn't anticipate that it would be a full 10%.
There is a correlation between additional revenue and expenditure. However, there's not as much elasticity as you would expect of one to one ratio. As we bring in more revenue, we look at resources that we already have. So an additional amount of revenue doesn't simply equate to an additional contract to a third party. We may look at a current resource and staffing that may have opportunities to focus on different efforts and look at those additional revenue in a more efficient. So the correlation is hard to report.
Yeah, I think for me, the biggest reason I asked that question is and I don't want to say fear, that's not the right word, but the desire to not want to have to give money back that's unspent. So if there's new funding coming in and new revenues, that they are actually all being spent and not reverted back to state, federal, or other sources.
So we've learned a lesson from the county when they put out requests for additional funds. Usually it is 10 times, 20 times the amount of revenue they have available for those specific. I believe we have enough that can be considered to ensure that all additional revenue can be realized. If not, we have conversations that we don't have to allow for more flexibility when that's good.
Your explanation, that was nice and clear. Okay, I need a motion to, accept the financial report.
I'll motion for that. Thank you, Joe. Very nice.
Okay, all in favor? Aye.
Aye.
Anyone opposed? Nobody's opposed, I heard 3 ayes. Okay, it passes. Thank you.
We're good.
So,
I think I'm next on your agenda. Well, I could
are
say.
you next? Yes, you are. All right, I was.
Yeah.
Okay, so Joe, can proceed with, we're moving to new business and proceed with telling us about the 2025 fee schedule once you. Well,
Thank you, Gary. And as I say that, I now am having trouble finding, so it's my own part of that. The fee schedule for next fiscal year for the 2025 year was indeed included in the board packet for this year. I won't spend much time going through too much detail. I won't spend time going through a lot of the detail. What we've added for this year's or for next year's workbook are the notes we believe were necessary to give better, clearer understanding of how we came to the proposed for next fiscal year. You know, there were some questions about how we got to these figures, where the changes came from, and really how we developed the fee schedule. As you may recall, we had a study session presentation where we went through a lot of detail around the fee schedule. I hope that addressed some of the questions. I hope the notes within this workbook provide, sorry, I'm having a hard time.
And Joe, sorry, can you speak up again for?
Yes, sorry.
Thank you.
I knew where the microphone was, but that's okay.
So you say we can.
So at this point, I just wanted to ensure that the staff have put together the notes we believe will address some of the questions that the board members may have in relation to the proposed fees for next fiscal year. At this point, I just want to make it clear that we have all this information available. I'm not asking for a vote today. I'm hoping that the board has the information available, and if there's questions, to bring them to either mine or Lindsay's attention so that we can address that before the next board meeting. The intention is for the board to vote on the proposed changes for next fiscal year at the December meeting. At this point, I also wanted to ask, and this is something for the board to consider before the next board meeting, is whether or not the board members want to continue to see the fee schedule, the proposed fee schedule in future fiscal years, and whether or not they want to continue to vote on the proposed fee schedules, or if that is an item that we will continue to follow best practices and do our due diligence to ensure that we're recapturing as much revenue as possible as we provide these services. So that is another item for the board to consider before the December meeting.
So I do have a question related to that, that ask or that idea, which is whether there's any, regulations, from the state, from the feds, from anyone, that the board approved the fee schedule. I know that, I used to run an organization where there actually was a very archaic requirement that our board approve the fee schedule, which was very silly, but,
So at this point, I'm not aware that it is a requirement of the board to review and approve, vote on and approve the fee schedule. However, that is something I'm also going to try to look into with assistance of the county attorney's office to ensure that that is a possibility for the board. However, at this point, I don't want to lose too much time, and I wanted to ask that the board consider that before the next board meeting.
okay.
If, of course, it is a requirement of the board members, I will not be asking that question during the next.
My only time when I think it would make sense to ask or to get not board vote, but just notification is, I mean, I know like the restaurant food inspection is up for the legislature and for approval and renew this year is for us to know and understand if there is a need for the board to take action and support in increasing fees, for example. But I would guess that Kelly would probably give us updates on that. So that then we can know and understand how they're being implemented in the following year. But so that's the only thing. I don't know that we need to vote and approve them. I would just want us to be aware so that we can support the government.
I appreciate that. I obviously can speak on behalf of Kelly Wood here, but I'm under the assumption that if there's any significant change in that process, and even at the legislature level, that we can go to court and help with them, they would do so.
And my fee schedule is unreadable. I
Yeah,
don't know.
mine at home was too.
Oh, you mean that? Oh, yeah.
Yeah, no,
That's
no,
a-
no, like,
No,
PDF is
the letters went all over the place, as
Like it's-
opposed to staying where they were supposed to be.
I can send you a separate one.
yeah, if you, that'd be.
Sure.
great. It's just,
Looks like the translation of.
yes.
Yeah.
Okay.
The formatting got all messed up.
Formatting's really, I can't read, so
Yeah.
we can get one that's.
That, make it look like that.
Yeah, like
Yeah,
that.
yeah, that,
Okay, thank you for the reminder. I was also going to send the PowerPoint slides that I put together for the January study session as another reference, just to show that process that the department goes through in order to create this, the proposed. So I think that as a reference point,
yeah.
the notes
Great.
part of here, and it's at the board's discretion. If you want to continue to see the piece, the proposed piece, that we could provide it without a vote, we could provide it as reference material. A little bit further. from the meeting with the next one.
Yeah, and I can imagine, I don't know how everyone else would feel about this, but if there is a requirement of a board vote and there are not significant changes, I can imagine it being part of a consent agenda instead of having a full discussion
Mhm.
on it.
Yeah.
So, for conditions.
Yeah, that makes sense. Okay, thank you. So, anything else on the agenda, Joe?
Just sit down.
It says that Cody is our next, presentation on Effie Placemat.
Yep, and he just joined, so.
Yeah, can you hear me all right?
Yes.
Perfect. I got a new computer today and this is my first Zoom meeting, so I have multiple options of microphones. So I want to make sure I had the right one. So I wanted to just jump on here and give an EPI update, starting off with some feedback from last month on our EPI placemat. We have updated it in a few places. One, we've added COVID-19 into the conditions. We weren't able to make it fit into the existing chart, so it got its own little special place in the center of that middle panel, just as a little text report there, just a one-liner. On that existing chart, though, we've also added a feature to where all the bars that have newly reported cases are now multicolored. So you can see the original color on the left-hand side of that. And then if there were any new cases that were that came in the month before to this meeting, they're represented in the rust or burnt orange color. So you can kind of see what we've been working on in the past month versus what we've done all year.
Hey, Cody, can you share your screen so that I can see what you're looking at?
Yeah,
Thanks, sorry. They
no
had it
worries.
up for a while, like the screen was up for a while, but when you came on, it went away. So it just got turned off. If you could please just share again. Thank you.
And where is my Zoom at? There. We'll share this one. All right, how is that?
That's awesome. Thank you.
All right, yeah, so you can see here in the middle, we have our little text for COVID-19. And then on our existing chart, you can see all these burnt oranges, especially here in pertussis. You can see what we've been doing most of since the last time we spoke. Everything else about this chart has stayed the same. So the numbers on the far right of those are our year-to-date total. We also expanded the 5-year median, year-to-date median. It's just a little bit bigger of a line that overlaps the bars to be a little bit more visual. And
Cody, real quick, sorry. The burnt orange is since October.
yeah, so everything in the burnt orange will be from October 1st through last Thursday. Next month in December, that'll be everything from November 1st to the Thursday before the meeting.
Thank you.
Yeah. Moving from that chart, a little update on the respiratory season. So we are in the beginning of respiratory season, but it has started. We are currently seeing a more mild start than we have in the past 5 years. Usually at this point, we start to see an upward trajectory in ED admissions in our syndromic surveillance. But for the past couple of weeks, we've seen a pretty steady plateau in the number of admissions each week. We do expect to peak late December, early January. That's where we peak pretty much every year. So we do expect more increase in our cases. If we zoom out and we look at the North Central region and Colorado, as syndromic surveillance is showing us, they're seeing the expected steady increase in cases week to week. But we're just not seeing that yet in Jefferson County. Zooming out even further and looking at some CDC data, the CDC is reporting that 0 jurisdictions in the nation have reached a moderate level of activity. So everybody is still at low or no activity. And the CDC jurisdictions are just counties. Some good news for us when it comes to outbreak investigation is JCPH is taking our COVID-19 outbreaks in long-term care facilities back. We are reassuming ownership of those from CDPHE starting December 1st. Currently, CDPHE has been doing all of those outbreaks for us, but they're moving away from that model. And JCPH has elected to be a pilot county in that transition process, taking ours back before other counties across Colorado are, and giving them feedback on the best way to do that and things like that. This is great for our long-term care facilities. It makes reporting and our response a lot easier, as we can match what we do with all other pathogen outbreaks that we are already in charge of. So it makes it a little bit easier for everybody, not having to deal with two different agencies for two different things. Quick update on Mpox. I'm not sure if you have heard, but there has been detection of a clade 1 virus outside of African countries. This is the first one in the United States. It is in a resident of California who does have travel to affected African countries. We at JCPH are still ready to investigate and do contact tracing and notification for any clade 1 or clade 2 Mpox cases that arise in our county. And then my last little update is just on Marburg outbreak in Rwanda. We talked about that a little bit last month. But as of 11/15, Marburg or Rwanda is reporting the last case of Marburg virus being 10/28/2024. So we are about one incubation period passed from that last confirmed case. The outbreak will be considered closed when we've hit 2 incubation periods. So assuming that this 10/28 case stays the last case, we should see the end of our Marburg response around mid-December, about like December 11th or something. Assuming that we don't have any new cases reported in Rwanda or anywhere else. Currently, there have been no other cases reported outside of Rwanda. But those are my updates. Do you guys have any questions?
Any questions?
I don't have any questions, Cody, but as always, my favorite part of every meeting is Cody. Hey, that's really something about COVID. Congratulations on being a part of that pilot project. I understand like the workload will increase for the team. However, how exciting that you were chosen, your team, you and your team, we, JCPH, were chosen to do the pilot program. That's incredible. And I can't wait to hear more about it as time goes on. So please keep us posted as to all the good things that we're going to hear about the team as a result of taking this on. So it gives us something to brag about.
Yeah, absolutely. We're with a few other LPHAs who had jumped at the opportunity to take these back and lead the state in this pilot program.
Yeah, that's great. Good report, Cody. Thank you very much. The next 3 items on the agenda are all Lane's items. Lindsay, have we heard from Lane?
Yeah, he is gonna jump on, but I think we can move ahead to the director's updates if you wanted to just wait.
Okay. And then
For
let
his
Lane
items.
when
Yep.
Lane gets on, why, okay. All right, so we will jump over the last 3 items until Lane is with us. And we're gonna move down to departmental updates, and I will turn it over to Dr. Story.
Thank you. I'm going to share my screen and then it will be taken over by Kelly after I'm done with my little part. Let's start. There's too many people like facing on here. There we go. Okay, I'm gonna make it big and there we go. Okay, thank you to Kelly for making the template for us all to do it on the same template, so we don't have to switch back and forth. I will try to be loud, so the microphone picks up, but I sent an all staff email this afternoon about some of these updates. So for more details, board members can sneak into their email inbox and read a little bit more about those. So just a few kind of executive level updates. yes, I went to Delicate Arch for the first time. That was very exciting. I have to thank Christine, who convinced me to buy headlamps and get there before the sun rose. So I'm continuing to love being here, and exploring our surrounding nature. The high level updates I want to give to the board today. As you know, we're exploring kind of a distributed model. We're calling it for public health services and moving out of Parfit little by little. Mostly for two reasons. The primary being we need to serve more people and we need to be where people are. And we're committed to that. The second being that in our hybrid work environment that we have no intention of changing at the county level anytime soon. Our building is regularly about 30% occupancy and it's a waste of taxpayer dollars. So it's also old and full of flies and bats. So that's partially the reason. We have been exploring a move into this building on the 4th floor. That would be environmental health, all of our kind of backbone administrative work, me and our data science team, and basically everybody who is not clinical, not emergency preparedness, so they can float, you know. So we're exploring some different options there, but the big move would be here, and we are looking at a mid-2025 timeline, where we would take over a large portion of 4th floor. For our residents who interact with environmental health, we're working with facilities to have a great customer service workflow, information desk, wayfinding. So lots of exciting opportunities for us to interact with residents and less jumping around for them to go place to place to get their services. So that's the most important thing. We are working with all of the division directors to establish, you know, how many people are there every day, who needs a door, who doesn't need a door, how many private spaces do we need? And that's, you know, a big undertaking. And so I want to really give my gratitude to Lindsay and to Joe, who have been walking architects around and poking in places and vacuuming up bugs. I mean, they've been just doing such an amazing job at leading this project. I'm very grateful for that. The second group of people to look at a move would be our clinical services and our Lakewood WIC office, which are both currently in Parfit. And as you know, we're exploring, actually, we are committed to a partnership with the Action Center and other community partners for what is currently called the Emory Commons, which is in the old Emory Elementary School. We are putting our money where our mouth is, and we are kind of staking some claim in that this year with some of the budget presentation that you heard from Joe. We do have the ability to put what I would consider a down payment on the complete redesign of our space. And the fun thing about this is we get to be involved in the ground floor as how to design a welcoming space for our clients. The downside of this project is that it is a longer timeline. Conservatively, we would say early 27, ambitiously late 26. So that means we're going to need to get creative about some temporary housing for some of our services in the late 25. So the board will be first to know, second to know after affected staff, but first to know if you'd like to look at your email inbox. And we are going to be having a town hall opportunity for staff in a hybrid capacity to ask the directors anything, to talk about any concerns they have, worries, because whatever worries staff have about moving, we have the same worries and we will figure it out together. That will be December 16th. In the morning, you can either come to the physical location where we'll be, which is to be determined because I didn't realize I was kicking someone out of the room I chose first. So we will update that, but it will also be online and very casual. And so I just want to create space where people can just air whatever they're feeling about these big, big changes. These are big changes, and though they are exciting, it's still changing. That's being hard. So the last thing we're exploring as well is space for our emergency preparedness team to be closer to the emergency operations center. which makes sense, right, for them to be all together, but we also wanna, really keep the staff like connected and exploring ways to do that digitally and not physically all the time. And I'm hoping more people will come in the office when we have a really beautiful place to work together. So that's my knock on wood moment there. So, I'll take questions at the end of the slide, but I'll just jump through these real quick. I'm excited to share that Christine Billings has a new title. And she will be serving as our Director of Strategic Initiatives. It's longer than that, but I kind of like the snappy short title. And in this, Christine will, in addition to her current role of overseeing data science and EPI and emergency preparedness, will be taking on these projects that are really high priority for me and for the other directors, but that cross a million teams or across different functions and departments and sectors. And we've been working with Kim Boyd, who's here in person, which is exciting. Kim has been helping us think about how we shape our roles to match our strengths. And one of Christine's superpowers is finishing things. And she's an executor. And she is really good at matching people and keeping them motivated, but honestly setting a deadline and meeting it. And that's what we need from some of these projects. So for instance, one of Christine's major strategic initiatives in 25 will be our syphilis elimination program, which stretches across every team at JCPH. So I'm very grateful that she continues to serve JCPH and continues to make me go do crazy things with headlamps and brought cookies and brownies today, courtesy of her mother, but still she brought them. And just really is such a powerhouse at JCPH. So thank you for agreeing to step up into that role. Last two things, the Office of Assurance, which I've discussed before, is a merging of the health equity team and the health planning team. There's more info in the email, but they are moving forward, have established a charter, also working with Kim. And so we will see really great things out of that new office. They report to me. It is kind of an executive function and they are getting to know each other and learning to work together. And it's been really beautiful to see. So we will have them come probably study session at some point in 25 to update you on all of the exciting plans that they have. Lastly, I'll be heading to DC December 2nd for a federal health policy forecast, which should be really interesting. And it's all focused on social determinants and health equity and what the next couple years might look like for us. So we'll make sure to report back to the board after that meeting and wish me luck and pray for me there. That should be a lot of fun. So that is the big stuff. Before I hand it over to Kelly, I'll sweep through some communications campaigns and some congratulations to one team in particular, but any questions on, I feel like I'm cutting you off, I'm sorry. Logistics, moving, budget, anything related to that from the board, happy to answer those questions.
I do want to hear about the federal health policy meeting. That should be very interesting.
Yeah, maybe Dr. Oz will be there. He was just named to run CMS. I look forward to reporting back. And I will say, I am keeping, and I hope that our department is keeping an open mind about our ability to work in this, the federal ecosystem moving forward and find, Kelly and I talked about this morning, like finding windows of opportunity for Colorado to lead. No matter what happens in DC, we have a very strong public health system and we're committed to that. So I'm optimistic, but always love a DC visit. So, any more questions from the board about this stuff before I jump forward to?
I don't have questions, Dr. Story. However, I did want to congratulate Christine. That's great. Great news. And then I just wanted to share my intrigue, my interest, my excitement about Emory Commons. I look forward to hearing more about that as time goes on and just seeing how it all unfolds. I like to hear about this. I think it's a really neat concept. So I just wanted to share that.
Yeah, thank you. We're really honored to be one of the folks to be asked to be brought in. I mean, it's just, we just feel almost like coordinated, like we made it. Max and I had the opportunity to visit Inner City Health, who will be the main clinical provider of dental, physical, and some behavioral health, though JCMH is there as well. And I think we hit it off really well and should be able to divide and conquer clinical services. As you recall from last meeting, it looks like we are getting, I think I signed the paperwork, so I think it's ours, a second van. And so as we think about creative ways to get clinical services out there before our brick and mortar is established in Emory, we'll be leaning on that fleet a little bit more moving forward. So thank you, Rochelle. I really appreciate that feedback. We will talk a little bit about 1A when Kelly comes up here, which was a success for the county to pass that. And I know the board passed the resolution supporting it. And we had the office of, or the health equity team was out there knocking on doors for voter turnout. They contacted 400 people. I mean, it was all hands on deck situation. You will be hearing, probably in December, we'll be discussing more what's called the continuation budget that the county is presenting, which is if 1A passed, what will we do? We are not undoing our staff reductions. Some departments didn't do the staff reductions yet in hopes that 1A would pass, and then we'll be saving those positions. We opted to move forward with staff reductions. And we will be looking at repurposing that budget, the continuation budget for specifically for the Emory project in 2025 and some other strategic needs. But that I just did want to put that out there that there are departments who waited. We did not. We did that on purpose because we had our own budget reduction cliffs and with funding formula changes that we were facing, and to not make those decisions early, we felt was a disservice to the people who would be affected, so that we could offer severance and other accommodations. So that's just putting that out there, and more on 1A in a sec when Kelly comes up. I do want to congratulate the team. It's a cross-functional team. It's led by Allison Wilson, who is really just a champion for functional needs and access and functional needs. This was sent around. We'll make sure you have a copy. It's quick. It's a 2-pager, and the work that they're doing is so next level, to really inspiring all of us to be inclusive to people who have different abilities. And I just can't tell you how innovative this work is. And it was featured by NACCHO in October, Stories from the Field. That's a kind of a big deal. And they also submitted it for the annual conference in July. And if you'll recall, I think we bat 800. I don't know how you talk about batting, but not 1,000. We were at like a 90% success rate with our submissions last year. This year, I think we're going to go for 100%. I want to say thank you to the teams who submitted. That's a lot of work to put together an abstract submission for the summer of 25 in the fall of 24 to think ahead. Noella's in the room, and Noella and Kelly and I put together a communications submission. We've got policy as like a partnership with Adams, quality improvement. We have a session, a workshop we put forward on emotional regulation in public health departments, which is so fantastic. And then we have 2 submissions from the harm reduction and Points West team. So congratulations ahead of time declaring success over all of those teams. And I can't wait to see you all present in Anaheim. And I made sure they didn't just want to give it to them. That was the first question. And then last, please share on social our latest campaign, which is a little different than what we normally do around Thanksgiving. Is while we're still doing resident outreach related to food safety. So we've got some cute little magnets and meat thermometers, and we'll be having our community organizers go door to door and just make sure we're meeting people where they're at in their homes. And we're going to Belmar. We're going to talk to people about their turkey temps. But we really wanted to use our social space, our visual space for food insecurity campaign, which is a weird time to do that, right? When everyone's sitting around eating. We thought this was just a good opportunity to center the conversation around people who just won't have a full table. Thanksgiving is a little bit later this year, and for those of you who may have ever had to budget month to month and the money runs out at the end of the month, and then having a Thursday holiday that's at the end of the month because the month started on a Friday, it makes a big difference. A few days makes a big difference. And so we're seeing the impact of that timing, in our partnerships. I'm hearing this anecdotally from our food bank partners. And so, what there are links on our socials to either get connected to services or volunteer and support. I do want to thank the comms team because they're just bold and creative, and you'll notice this is one of the campaign images that was on LinkedIn on the right, our right, this empty table with people around it. You may recall that in March, when we kind of kicked off our new campaign planning approach, we started with National Nutrition Month. And so that picture is actually the same photograph from our campaign in March, where it was all about celebrating togetherness and food, but it was completely removed. And so I just have to really shout out Noella and her team for like these ideas that we have in the room that were like, what if we did this, but like took all the food away? And she just delivers and her team delivers, and they are about to onboard a new hire offer for a creative. So just like onwards and upwards, and thank you for all of your hard work and embracing all the crazy ideas. Really great and beautiful. So thank you for that. And that's it. And I think it's Kelly's turn now. And thank you for the time, and hope Blaine's okay. Blaine here? There he is. I see the northern lights.
Yep.
We switched around a little bit, so. I'll stop sharing. I was in. Hop in. Yeah, okay. So I don't want to run your slides. It's too much. I'm running their slides. So I'll take the stress about it.
I do have an election update for you all, but before I move into that, I think it's great to mention our honorable mention as the department has had a new process for recognizing folks department wide as our employee of the month, and for that process is another mention to my office. So Rebecca Levy, I'm talking to the things and I think today.
Loud.
Sorry,
for the
Rebecca,
crowd,
if you're
it's
loud. She's with our tobacco team, and she's been with us for a little over a year now. And amazing, she can come in, which only realm, which is in a lot of our tobacco's work with our school partners. It's been awesome to see and really growing, their development of our partnership with the schools. And that's it, I continue on, so I think that she's sharing her own vision of Rebecca. Actively with posture test, Rebecca is also deeply respectful of and sees the good in others to amplify and support the collaboration. Whoever relates to others in ways that elevate their value, and ideas, and competency, and set of their work. Even noticing what's going great, what's possible, and even noticing when others see chaos and doubts. She readily dives into complicated projects, and her optimism allows her to see what's working in these efforts. I saw that my director supporting the years.
And
So what is up with the microphone?
they just for some reason can't hear, they can hear some people and they can't hear Kelly. And then they are saying you're talking a little too fast. So,
Let's see if we
yes.
can like adjust the sensitivity of the microphone before everyone has to scream at the.
yeah.
It being a room of microphones, it should be microphone.
So I want to echo the recognition and thank you to Rebecca on our team. I'm excited that she's here and grateful to watch her work supporting our youth interns over the summer. I'm excited to see what comes out of our community work with this as well. Let me try to bring in the slide. came up with that not for anyone.
Yep.
Perfect. So I thought it'd be good to start with voter turnout this time around, for Colorado and for Jefferson County. Compared to the last election 2 years ago, unsurprisingly, and we saw much higher voter turnout rates both in Jeffco and across the state. I'm proud to say that Jeffco has a higher voter turnout rate than Colorado as a whole. Colorado, online votes.
Yes, there's 400 people, probably the difference.
Yeah, we'll just take that. So it was really encouraging to see the voter engagement in the election this time around. Also want to run through some of the statewide ballot measures that were voted on that have an access in different ways with public health. So that full slides with these. Amendment D expands property tax exemptions for disabled veterans to another category of disabled veterans. So helping with some cost savings and economic relief for groups that are facing some hardship. Amendment J, which removes Colorado's ban on same-sex marriage. This hasn't been operationalized for many years at this point. That's the overall decision of the Supreme Court nationally. This ballot measure ensures that it's all. We have that protection here at Colorado at the state level. 79 enshrines the right to abortion care in the Colorado Constitution and allows public funding sources to be used for that primarily in public insurance options. There was ballot measure amendment 80 around creating a similar right to school choice for students in K-12 settings that did fail. This change was nothing about families' access to different schools as options, whether they're charter school, their community school, or any other type of school choice that they have. It just doesn't create a right to it. There's one in Colorado that the option is remain available. Proposition JJ on sports betting revenue. So this allows the state to retain all tax revenue related to sports betting and uses it to fund water conservation. So that's some analysis there at the state level, some environmental health and water conservancy work. Working through some of the other state measures, Prop KK establishes a new funding source for mental health and public safety funding through a tax on gun industry. 128 is a measure that would increase prison time by requiring folks to complete longer portions of their sentence before they be eligible for parole. Might be working through the safety priorities. 129 creates a new veterinary profession for mid-level practitioner. And then 130, which passed, requires the state legislature to allocate $150 million to law enforcement training, bonuses, pay, and some other benefits for law enforcement officers. And we're currently getting some updates about how the legislature might approach that. I think my understanding is about measure might allow the legislature to take that on and versus one whole thing this next whole year. So if those details come forward, that'll affect some of the budget. Cycling at the local level, Registry mentioned 1A, which is Jeffco passed. This allows the county to retain tax revenues for the priority areas that were identified through some of the polling work prior to the election. This is primarily around mental health and substance use, public safety, and critical infrastructure and bridges. We weren't the only county that had questions like that on the ballot. Arapahoe County had a similar question. Their focus included that critical infrastructure and public safety piece, but also included housing for their county groups. Adams County had a sales tax also related to housing, so that did not ultimately pass, but it had the funds really down for that need. And Denver had a similar sales tax around providing some additional funding to Denver health related to the amount of uncompensated care they're providing. So a number of measures, these aren't the only ones, but some of our closer neighbors. So I thought it would be helpful to kind of see some of the broader Denver metro context going on with our local ballot. Looking at some of the offices, Jefferson County has a returning place and Commissioner Anker, he won re-election for this seat for a second term. And then Rachel Zenzinger, who was term limited in the legislature, will be joining the Board of County Commissioners in January to take this seat for the term. It's held by Tracy Cathcart. We'll have a new commissioner, starting there. The legislative composition isn't quite final yet, hence the asterisk. So this is what kind of was projected at the moment. There are a couple races they're going to recount because it's so close. This might change by a couple of seats or so in the House. But it does look like Democrats are retaining control of both chambers, although their control, there's a majority in that House. So still majority led, but not quite as strong as it was before. So a little bit of shift, but not as significant as some other seats. Looking ahead to session, with some of these statewide policies will start to really get feet under them in legislative session as they look to enact legislation that operationalizes it. I expect that we'll see a lot of work around implementing the policies that were passed in ballot, a lot of defensive work around protecting certain things and pipelines at the state level. That folks may have concerns would no longer be in place at the federal level if there's change. And the main thing that will be the focus of legislative session this year is it's looking a little less bad than $1 billion deficits, but not by a whole lot. So there's already a lot of work going on around government policies for those budget that come out on the first. That's kind of a starting point for the legislature. They had a lot of agenda done around making numbers line up for a balanced budget. So we anticipate that that will probably be in Congress on federal bill. Now and it's out of the year. They were posted in the policy 5% cut to a portion of CPD's budget, which comes to local public health departments. We're aware of this, CalPO and CPHA are both also aware of this and working on some advocacy around that funding that passes. And looking at other budget impacts for that as well.
Anybody have questions? Well, I have one, and it has to do with, one A or two A?
One A,
One A and has to do with one A and KK. Because I'm very excited that they both include mental health. But I'm curious whether KK expands it and also includes substance abuse, and with both of them are going to be able to pay for prevention in addition to the actual treatment services.
you guys circle the hope, I think, as the legislature works on how that actually gets operationalized at the state level is when it doesn't become clearer, but that's certainly something that I can say that we watch for as those discussions start to roll out, and then we also double check the more detailed ballot language on if they would make sure they're working on the details if there are any pushback in there about how they need to divide that up among the different pieces of the spectrum.
Other questions? Okay, thank you. So, do we have any other?
Yes, we have, just Christine and not just Christine. Christine, we talk about severe weather, and then Alex has fun stuff at the end.
Alright, so good evening, Christine Billings with the help. I am just.
With the new title.
Yeah.
I am just here to speak a little bit, like really short, about a new collaborative opportunity we have with partners across the county with Jefferson County Human Services, our partners in emergency management at the county and the local level, the city of Lakewood, as well as other CBOs. And it's all related to severe weather and what we do to house and protect human health when severe weather hits within our community. On the heels of a lot of conversations, we've had our snow event about a week and a half ago, a multi-day snow event that hit the Denver metro area, our Eastern Plains, Albuquerque Road. We jumped right into issuing health advisories to our partners related to human health impacts and the potential for human health impacts related to weather. This collaborative group has come up with metrics that they are using to launch sheltering operations, both physical space as well as mental health vouchering. And then the communications campaigns that go along with that. We are on the human health notification side of that. The decision to operationalize all of those housing elements lies with the municipal and county partners. So we issue either a health advisory or a health alert, depending on what temperature it is, what precipitation is out there. We take into consideration wind chill. Our role is truly to alert about the impact of health as it relates to weather. And so we piloted this, we got it out the door, it was received very well. Made some changes, did our quality improvement process with an after action meeting and moved forward. So we are continuing daily. Our emergency preparedness team is responsible for monitoring the weather. We are learning a lot about weather. There is a agreed upon consistent source of data with the National Weather Service that we reference for our data and information. And we make the determination to issue these health alerts. What the rest do with sheltering is, as I said, on their side. But this allows for a collaborative approach based upon human data, which is very exciting. The other piece that's very hard to see because it is for internal use only, that we are using our syndromic surveillance to monitor hospital admissions and emergency department visits as it relates to cold weather. So our EPI team, the full platform of our data EPI and infectious disease EPI team are updating this syndromic surveillance dashboard. The bars that you see sort of shown on this graph are the days that we activated the first time. So we were correct that there would be human health impacts when we took these certifications out. But we're very excited to partner with all of our human services colleagues, et cetera.
Good evening, all. I am really excited and have the honor to share this month's Employee of the Month. And actually, for the last one of the years, a little different. We have a team that was, or 3 employees who were nominated by myself and Kylie Harrison. And so I'm really excited to share that our November Employees of the Month are Kelsey Rivera, Meredith Hunzer, and Michelle Rivers, who are our 3 WIC supervisors. During the significant leadership and staffing transitions in the WIC program over the past 6 months, Kelsey, Meredith, and Michelle have gone above and beyond to ensure the WIC team had the support and resources needed to continue serving Jeffco families with excellence. Their leadership and dedication to the JCPH WIC program has provided much needed stability for the program and its staff. As the WIC leadership team, Kelsey, Meredith, and Michelle embrace their individual strengths while exemplifying the JCPH guiding principles. Together, they navigated numerous changes with empathy and integrity, advocating for the needs of staff while remaining focused on the WIC mission. Each of these supervisors approached changes in program staffing and structure with respect for their colleagues, advocating for transparency and communication throughout the process. They actively listened to feedback from program staff, bringing staff concerns and insights to the forefront. Their commitment to respectful communication helped reassure the team during these transitions. Kelsey, Meredith, and Michelle embodied a collaborative spirit, working closely to make crucial program decisions and keeping the mission of WIC at the center of their work. Instead of individual agendas, they prioritized shared goals, valuing each other's perspectives and expertise. Their unified approach reinforced that every team member played a vital role in achieving the program's mission and set an example for the entire team. When it was clear that staffing reductions would require changes to clinic hours and a reassessment of the hybrid work schedule, Kelsey, Meredith, and Michelle collaborated to find a creative solution. Together, they developed a schedule that balanced the needs of the program with flexibility for staff, allowing for a hybrid work option even amid staffing reductions. Their ongoing commitment to flexibility has enabled them to balance staff requests with program requirements. This adaptive and forward-thinking leadership has been essential in supporting the long-term success of JCPH WIC. I am deeply grateful for their dedication to their team and their community. I will say personally that without them over the last 6 months, I don't think that myself or the WIC team would have survived all of these transitions. And so thanks to their leadership, we have been able to maintain continuity of WIC services for Jeffco families without disruption. So congratulations to the 3 of them. I think all 3 of them are on, so I'm gonna stop sharing, and if the 3 of you are on and wanna turn on your cameras and wave. Yes, Meredith.
Congrats.
And
Oh,
Kelsey.
there's Kelsey, got all 3 today.
Thank you.
Congratulations, ladies. It's awesome. Great job. Looking forward to seeing you at Employee of the Month.
Yes, we will celebrate with all of you. We'll have a bigger table than usual. Okay, so we, Lane, welcome to the meeting. We
Yes,
skipped
my apologies
over-
for being late.
We skipped over the 3 items that list you, the new member orientation packet, the meeting schedule, and the elections reminder. And we jumped on down to the departmental updates, and now we'll come back up to your 3 items.
Great, thank you. And the first one will be fairly short, just I guess sharing that we are trying to have a more robust onboarding package for new board members. So Lindsay has an initial draft, and I'm going to do some additional work, and then we'll circulate it to the board members for your input, especially for folks that have joined recently, because your input is really essential to making sure we get people up to speed right away and active as board members. So, so more to come on that. The next item is a proposal for modification to our Board of Health schedule, and proposing to start that next month. I think we will still need maybe an abbreviated board meeting, but the idea would be to move to board meetings every other month, and in the months between having alternating between more of an extensive work opportunity for the board and staff. Maybe consider it like an abbreviated retreat where we have more chance to work on some of our action items and engage more directly with staff. And then in the other meetings, when we don't have, or other months when we don't have a board meeting, we would have a more robust study session. So an opportunity for potentially multiple programs to come before the board, potentially sharing questions that they might have for the board in advance so that the board can come prepared and have more robust interaction and dialogue with programs. So again, starting in December, that's where we would have our first sort of board and staff opportunity for more engagement to work on things we identified in our retreat, potentially the Board of Health onboarding packet, things like that. January would be back to a normal board meeting. February would be a more robust study session. So that's kind of the idea to put forth to the board members for consideration. We can share ideas of programs we'd like to hear from, but really leave it to staff to identify the proper cadence based on who has things that are more timely to come before the board, who's ready to come before the board, things like that. Also, if there's any kind of immediate need, we can still schedule a board meeting on months that we weren't planning to have a meeting, just to make sure we're meeting the needs of the agency. So I'll just leave it for there right now and entertain any discussion from the board members on that idea.
I like it a lot for a lot of reasons. It meets a lot of people that we have said that we need to adjust. My biggest question is, will it still be on, all of these still be on Tuesday, the second Tuesday or whatever?
Third Tuesday.
Third Tuesday, whatever it is, sorry. You know what day it is. third Tuesday, around the same time.
Mhm.
Ideally, it would be because it's already kind of saved on
Yep.
the calendars. Okay.
Yeah.
Yeah, I think that's something for us to discuss at next month's meeting is the time of the meetings. But as of right now, I think we wouldn't want to change it until we have more discussion. One thought, though, is it is challenging to have these meetings during work hours for the public. And I think for some of us board members who have positions, full-time, that is a challenge to juggle that. So that is a consideration we could talk about is the time. I think it's more convenient for staff because it's fitting into their work schedule, but that will be another thing for us to talk about as another possible change.
That was a question that I had as well. I also want to clarify, are you talking about, trying to figure out how to say this quickly or briefly. Every other month we have a meeting. And every other month we have a get together that's not a meeting. Every other one of those would be a study session and the other ones would be retreats, or we're talking about one retreat discussion next month. And then from then on, we go to just alternating between regular meetings and study sessions.
Yeah, so the board, we will have, every month, we will be engaged in some capacity with either the rest of us and with the department. But an official board meeting would only be every other month. So we would alternate in the months we don't have board meetings between robust study sessions with programs and then work sessions for us as board members to kind of engage on activities and items that we've set as goals for ourselves so that we're actually carving out time to work on things. So that was the idea. So we would still be getting together on a monthly basis. It would just be a matter of what is the subject matter for that month. Is it a board meeting? Is it a learning session, an engagement with programs, or is it a work session for us as a board? So not adding more time to your schedule, but just hopefully using our time more in a more focused way. So we're still hopefully meeting the needs of the department and having further and stronger engagement with them, as well as more time for us as a board to actually put work into things. And again, this is a suggestion and open for everyone's discussion and fine tuning to make sure it's hitting all the marks that everybody is seeking. But definitely appreciate Lindsay and Kim. We had a meeting after our retreat, and this was really the proposal that came out of that. So appreciate their thoughts and energy into this proposal.
There was whispering down on this end of the table about no matter what, they're all public meetings. So just wanna make
They
sure.
would be, just like our retreat was a publicly noticed meeting. The intent isn't though for them to be the same as a board meeting, so we wouldn't be offering public comment and things like that. So when we have a study session, it's really for us to work with programs, but the public could listen in should they choose, and I would welcome that for them to hear more in-depth information about what's going on in the work of programs. So, but yes, they would still be public meetings.
You want to take over running the meeting, Lane, or shall I keep taking this from item to item?
Up to you. And it is hard. I could just say the audio is a little hard to hear, folks. But the last thing I think is more just a reminder, I guess, that we will have if we want to adopt. So before we move off of that, if folks like this plan, which we can obviously revisit and see is it working, but if we want to put that forward and start that next month, I think it would be a motion and a vote from the board to alter our schedule.
Okay, you want to make that motion?
I'll move to approve the new board schedule as proposed and described.
There's a second?
I'll second that, providing Sherry's on board.
Yeah, and I don't know for sure. I think was able to at least broach the idea with Sherry, but I don't have an affirmative that she likes it. But again, let's start it next month and we have the opportunity to tweak this, especially anybody if if it doesn't feel like this is actually serving the needs that we'd hoped it would.
So just to clarify, the motion really is for next month's meeting. And it's starting a process that still can be discussed and changed at future meetings.
Yes, for next month, we still would need an abbreviated board meeting. There's some things that we need to be able to do. We need to adopt the fee schedule for the agency, and we would need to do board elections and if there was anything else that came up for the agency that we have to resolve. Otherwise, it'll be an abbreviated meeting, and then we could adjourn that meeting and just go into a work session for the board. And then January, we'd back to a normal board meeting, and then February would be a more robust study session. And then we would kind of repeat that cycle.
So we have a motion and we have a second, and all in favor?
Aye.
Right.
Anybody opposed? Okay, so Wayne, anything more about the election?
Nope, just that will be one of the agenda items for next month is to elect our board positions for next year.
Okay, you want to take us through the end of the agenda, or shall I keep doing that?
Let's see, I think we're
We're on the staff.
department updates, so now we're at staff comments.
Yeah.
Any staff wishing to provide any comments for the board or the greater good? About Board of Health comments.
I have a, comment, maybe question, I don't know the right word. So last Friday, HICPAF received word that the 1115 amended waiver was approved, which includes expanding Medicaid access or available to community health workers. It includes a lot of health-related social needs, including nutrition services and housing services, which would go into effect July 1. And I know the department's been working on billing Medicaid more, and I just wanted to make sure that the department's aware of it and that there is action being taken to ensure that there is the ability to kind of work with the Medicaid offices to actually support the health-related social needs and other system improvements that we see with the amended 1115 waiver. It was just last Friday, so I doubt anybody's really dove that far into it, but there's going to be a lot of rollout of that in the next several months, and I know a lot of public health departments are working at and understanding what their role is in that, and just want to make sure we are. Oh, and congratulations to Christine on the new role and to the employees of the month. Question is the employees of the month did lunch, the one that's on December 11th? Okay.
Yeah.
I wanted to make sure. Congratulations, much appreciated for all of the exceptionally hard work that you did. That's all.
So, anybody else?
I think I shared enough comments throughout the meeting, but again, just great job, everybody. Keep up the great work.
So I would say, that's great news about that waiver. And hopefully we'll give a lot of needed flexibility, and hopefully nothing's going to happen on a federal level that messes up the planning for that. I also want to say congratulations to Kelsey, Meredith, and Michelle. It's great to have a team at the next lunch, and to Christine. that's very exciting, and, I think we'll be well served with the new duties you're taking on. And I think that's pretty much and I'm excited to hear about our role with severe weather. As a volunteer in Arvada with our severe weather shelter. Anyhow, it's kind of a mess. It's been a mess to pull things together, but, it's exciting that the county, the health department has a role in that, and hopefully, things are gonna hold together well. So, that's all.
Yeah, and I apologize, I couldn't hear Kelly well when she was giving her update, but definitely very happy and pleased that 1A passed. I couldn't tell how much you got into the governor's proposed budget that has a proposal to cut local public health funding. So CALFO, the Colorado Association of Local Public Health Officials, is looking to try to work with the JBC to potentially alter that. It isn't overall, I think, a huge financial impact to Jefferson County, but coming on the heels of the kind of financial situation that we already have in Jefferson County, looking at federal projections on potential significant cuts to a lot of health and environmental federal departments, it's still another potential impact to public health, who's always been chronically underfunded. So looking to potentially try to alter that final budget, but I did see at least the slides. The state is in a really difficult spot with $1 billion to try to deal with. So so it may be difficult for local public health to truly weather not seeing any impact from that, but just wanted to touch on that. And again, appreciate folks, and thank you for carrying on when I couldn't be here. We've got a whole bunch of grants we're trying to get finalized. So I got a meeting that was not on my calendar added and didn't get this one transferred over from the new laptops that we have, and then couldn't get on Zoom because it wasn't downloaded yet. So finally got it all working, but I appreciate all of you carrying on.
So shall we jointly adjourn the meeting?
Yeah, you've got the gavel, so you get to
I've got the
have fun with
gavel,
it.
okay. Without any objection, we're adjourned.
I think that's-